Hello and welcome. Let's discuss gastrointestinal system. Let's start GI tract. It's chapter 24 in this book. So let's go through, let's talk digestive tract, digestive system, gastrointestinal system, whatever you want to call it there. First, let's go through, let's mention some functions of the digestive system. Here we can see when we talk digestive system, we'll go through the different components that make up the digestive system and we'll check it all out. It's basically going to run from the mouth all the way down to the anus. And we'll go through all the different parts and check all that stuff out. So here when we go through and we talk functions, first thing I'd like you to know, the digestive system is going to take in food. It takes in food and it'll break this food down into nutrient molecules. It will break it down into nutrient molecules. Then it'll absorb these nutrient molecules and it'll absorb those nutrient molecules into the bloodstream. Once it's absorbed whatever it needs to absorb, whatever is left, it will then rid the body of these indigestible remains. So when we go through and we talk functions, you can see all the main functions we've got there, and we're going to go through each of these functions there one by one as well. So then let's move from that slide over to this slide here. It's the same slide as we have on the first page. However, it's just a little bit less info on there, and we can see what we need to see in greater detail. So here when we go through and we talk about the components of the digestive system, let's go through those first, and then we'll go through each individual component. We'll talk and check each one out one by one. So here when we go through and we check them all out, now here we've got first, when we go through and we talk the components, we've got here, so let's go through then and let's talk about and let's check out all the various components of the digestive system. So here when we go through and we talk about the components now of the digestive system, here we'll go through and we'll basically classify them into a few different categories. So here now we could see, so when we go through the components, again now here we could see we're going to start off with throwing these different components into two main categories. We're going to have, let's see here, we're going to have what we call our alimentary canal, and then we will have what we call our accessory organs. So here you can see alimentary canal. It's basically from the mouth to the anus. And when we talk alimentary canal, also known as your GI tract, like they're telling us, also known as your GI tract. So when we talk alimentary canal, I'd like you to know that the alimentary canal is going to be a continuous muscular tube. It's a continuous muscular digestive tube, you can even refer to it as. That's going to wind through the body. That winds through the body. And you can see that there very well. Now, when we talk about this alimentary canal, I'd like you to know the organs of the alimentary canal. So when we go through and we talk about the organs of the alimentary canal, you'll see the organs of the alimentary canal now are going to include the mouth, number one. So we can start right at the top. We've got the mouth, number one. Right after the mouth, the oral cavity, we're going to appreciate the pharynx. Right after the pharynx, then we have the esophagus. The esophagus. After the esophagus, then will lead to the stomach. Here we've got the stomach. After the stomach, then you can see we've got the small intestine. Small intestine comes around. You can see it here very nicely. And then the small intestine will lead us to the large intestine. And here we can see, bringing us all the way down to then the anal canal and the anus, ending basically there. So that is your alimentary canal, your GI tract. Now, we can see this alimentary canal, it extends for about 30 feet. It's about 30 feet long. And just as you can see here, and then when we start to talk about all the different, you can see there you've also got villi and microvilli, and that all just increases the length that you have inside of there. So again, about 30 feet long. Now, when we go through and we talk accessory digestive organs, now the second classification, now these accessory digestive organs, it'll include number one, the teeth. It'll include the teeth and the tongue inside the mouth, so the teeth and the tongue inside the mouth. It'll include the gallbladder. You can see as we continue down, the liver and the pancreas. So here we can see, when we go through, we talk teeth, tongue, inside the mouth. We've got these various glands here as well. These are all going to be our salivary glands. And then we've got other glands, the liver and the pancreas. And then last, we have our gallbladder. So all accessory digestive organs. Accessory digestive organs. Now, when we go through and we talk about the digestive process, when we talk about the actual digestive process, here you can see now, moving back to this picture, we can see the digestive functions. Basically, these are the processes. We can appreciate them then in greater detail here off of this slide. So here when we go through and we talk about these digestive processes, the first process that I'd like you to know about is going to be ingestion. Now, when we talk about ingestion, ingestion is talking about the process of taking food into the digestive tract. Talking about taking food into the digestive tract, and this occurs usually via the mouth, orally. Second process I'd like you to know about here is going to be propulsion. Propulsion, now we talk propulsion. Propulsion is the process of moving food through the alimentary canal. It is the process of moving food through the alimentary canal. And this process moves food through the alimentary canal by swallowing, number one, which is initiated voluntarily. So by swallowing, number one, which is initiated voluntarily. And then number two, by peristalsis. And also by peristalsis, which is an involuntary event. So swallowing and peristalsis. Some will consider segmentation. You see here segmentation? Some will consider segmentation as also a type of propulsion. It's a mechanical digestion and also a type of propulsion. So here we'll check at that. We'll look at that and we'll check that out before we finish here. So next up we have mechanical digestion. Now we talk mechanical digestion. This process, mechanical digestion, is going to prepare food for chemical digestion. Mechanical digestion. So mechanically digesting our food, you can think of. It prepares food for chemical digestion by enzymes. Now when we talk mechanical digestion, we're talking chewing, churning, and segmentation. Chewing, mixing food with saliva, right, by the tongue. Churning, as we can see, is going to take place inside the stomach. It's a powerful pulverization that's going to happen to the food. And that's going to happen because the stomach, you'll see, has a third layer of muscle. Normally speaking, we've seen how many layers of muscle? Very good. Very good. 2. Next, then, let's go through and let's talk chemical digestion. So when we talk chemical digestion involves a whole bunch of catabolic steps. When we talk chemical digestion, here we'll see food molecules are broken down to their chemical building blocks. They're going to get broken down to their chemical building blocks thanks to enzymes. So going back to mechanical digestion, we talked churning, chewing, and then segmentation we have there as well, right? That's going to happen inside the small intestine. Another type of mechanical digestion. So when we talk segmentation, okay, peristalsis we've already talked about. We said it's an alternating contraction and relaxation of the muscles, which allows this forward movement of food. Now in segmentation, what happens is this food is getting kind of broken down as it moves. You can think of the easiest way to describe it as 2 steps forward, 1 step back. So when it moves 2 steps forward, 1 step back, 2 steps forward, 1 step back, 2 steps forward, 1 step back, 2 steps forward, 1 step back. Here what's happening is, number one, we're having a propulsion. The food is moving forward, as we described. Number two, what's going to be happening is it's getting smeared along the walls. And that's a type of mechanical digestion we're having take place there. So that's all getting everything ready for chemical digestion. So when we talk chemical digestion, food molecules are going to be broken down to their chemical building blocks thanks to enzymes. I like to think of enzymes here in the digestive tract as biological scissors. They're like biological scissors. And they break down all categories of foodstuff. Next one, we've got absorption. Let's talk absorption. So if we have chemically broken this food down, next we can move into absorption. Absorption now is talking about the passage of these digested end products Talking about the passage of these digestive end products from the lumen of the GI tract then into the bloodstream. Into the bloodstream. So it's a process that the digested end products are going to take when they move from the lumen of the GI tract through the mucosal cells. And that'll all happen thanks to active and passive transport, which you learned from biology. And they'll move into the blood or the lymph. Defecation then we have last. Defecation now is the process of elimination of indigestible remains. Indigestible substances from the body via the anus in the form of feces. So removal of indigestible substances from the body via the anus in the form of feces. Next then, let's move down to the peritoneum. Let's discuss the peritonia. Now when we go through and we talk about the peritonia, here we can see the peritonia is going to be basically a slippery serous membrane found in relation to the ventral body cavities. Now when we go through and we talk about this peritonia, the peritonia is going to have two parts to it. Here we can go through, you can see all the different peritonia we're going to go through and we're going to eventually talk about, and you're going to have to know every single one of them. Here you can see various peritonia, same thing here. Okay, here it gives us a basic idea. So it's a slippery serous membrane that covers the ventral body cavities. Not only the organs, but lines the cavities as well. So here when we go through and we talk, we have first what we call the parietal peritoneum. So we talk parietal peritoneum. Parietal peritonia is going to be the peritonia that's going to be found lining the wall, if you don't recall from the beginning of the semester. So here we could see that parietal peritonia lining the wall of the cavity. Now when we go through and we talk parietal peritonia, it's going to be continuous, as you can see in this picture as well. It's going to be continuous with the visceral peritonia. So visceral you see right on top of the organ. Same thing we're showing here. Right on top of the organ. So it's going to be covering the external surface of most of your digestive organs. Next here we can appreciate mesentery. Now mesentery, we see mesentery is a double layer of peritonia. It's a double layer of peritonia. You can think of it as a sheet of two serous membranes that are fused back to back. That extend to the jejunum, the ileum, or you can say to your digestive organs from the body wall. What does this mesentery do? Number one, the mesentery is going to help hold the organs. It's going to tether them to the back wall. So you don't see the organs just fall right out. You know, if somebody was to stand up, I mean, they'll have a little bit of a play, but they're not going to just fall right to the floor, you know. So next thing we have, not only are they going to be tethering the organs, but they're also going to provide routes for blood vessels, lymphatic vessels, and nerves to reach the digestive viscera. And the nerves to reach the digestive viscera. Now when we go back and we look at the parietal and the visceral peritonia, between the two we can appreciate the peritoneal cavity. Now when we talk about the peritoneal cavity is going to be, it's going to be found, number one, between the two peritonia. It is a slit-like, it's a slit-like potential space, it's a slit-like potential space that contains fluid. It'll contain fluid, and it's going to help keep those organs from generating friction. So let's move then to the back of the peritoneum, and let's talk about the retroperitoneal organs. Now when we talk about the retroperitoneal organs, retro, taking it back, right? Retro night at the club, taking it back to the 70s, 80s, right? Yeah, don't say 90s, okay? That's not that old. So 70s and 80s you can think of. Retroperitoneal organs. So organs behind the peritonia. So retroperitoneal organs, organs located behind the peritoneum, and they're organs that adhere to the dorsal abdominal wall. They're organs that adhere to the dorsal abdominal wall, and they lie posterior to the peritoneum. And they lie posterior to the peritoneum. Retroperitoneal organs. Let's go through the histology. Let's check out the histology then in relation to the digestive tract. Now, when we go through and we talk about the histology here, we're going to go through the various layers that you can see here, and we'll go through basically the histology of each of the different organs as we go through them also. So here we can see, number one, we've got the mucosa. We've got mucosa. When we talk mucosa, mucosa is going to be making up the innermost layer we can see here. So we talk mucosa, you can see the mucosa right inside of here. Now the mucosa is going to be made up of a few different parts. The first part here that you have to know about is going to be the epithelium. You can appreciate the epithelium right inside of here. This epithelium now is going to vary as you move from place to place within that alimentary canal, right? This epithelium, it's a moist epithelium that lines the alimentary canal from the mouth all the way to the anus, and you should know every single region and what type of epithelium that it has there. Because we've already gone through them. This isn't the first time you're checking them out. We've talked oral cavity, we've talked esophagus, we've talked stomach, and we're basically going all the way through. Typically, it's a simple columnar that's rich with mucus secreting cells. That's just typically speaking. Like I said, we're going to go through each and every component. You'll have to know them from every single one of those alimentary canal components. So next here, then we can appreciate just beneath that mucosa, mucosal epithelium, we've got lamina propria. So right inside of here, this is all lamina propria. The lamina propria, we see here it underlines the epithelium, and the lamina propria, it's a loose areolar connective tissue. It is a loose areolar connective tissue. Continuing to move even deeper, now we can appreciate the third layer. So here you can see it's a nice scant layer of muscle, a nice real thin layer of muscle. What type of muscle? Cardiac, right? No, smooth muscle. Smooth muscle. So when we talk smooth muscle, you can appreciate this muscularis mucosae. The muscularis mucosae is external to the lamina propria. And what it is it's a scant layer, like I said, of smooth muscle cells. And they're responsible for producing local movements. They will produce local movements. Next, let's move to the submucosa then. When we move to the submucosa, it's going to be found now external to the mucosa. So here you've got the mucosa. We move out. Here we can appreciate submucosa. Submucosa. Now submucosa is areolar connective tissue. It is areolar connective tissue, and it contains, you can see here, a rich blood supply. It's areolar connective tissue that contains a rich supply of blood vessels and lymphatic vessels. You can see the nerve fibers in there as well. And also we can appreciate in here lymphoid follicles. Here's some glands. Here's some lymphoid tissue. The follicles would look similar to those organs there, but in this deeper layer. Next then, from the submucosa, we're going to be able to appreciate the muscularis externa. The muscularis externa. When we talk about the muscularis externa, it's going to be surrounding the submucosa. It will be found surrounding the submucosa. And this is the layer that's responsible for segmentation and peristalsis. This is the layer that's responsible for segmentation and peristalsis. Here you can see this layer is made up of a layer of circular smooth muscle cells and a layer of longitudinal smooth muscle cells. Then we've got the serosa. We talk serosa, it's a protective outermost layer The protective outermost layer of intraperitoneal organs. It's basically the visceral peritoneum. Now here in relation to it, the serosa, we can appreciate connective tissue. We talk connective tissue. Connective tissue is going to be areolar connective tissue, and it's going to be covered with mesothelium. So epithelium, you can see here, is going to be mesothelium. And we all know what that is now. Let's move then to another layer we can see out here, and that's going to be in only certain organs. This is the adventitia. Now we talk adventitia, it's in the esophagus, we'll see, is where it's going to be found. So in the esophagus, what happens is the serosa is replaced by adventitia. So in place of serosa there, we have what we call adventitia. And what it is, it's ordinary fibrous connective tissue that's going to help bind the esophagus to surrounding structures. So it helps to bind the fibrous connective tissue of that esophagus to the surrounding structures. So let's go through the various organs. Let's start off by talking about the mouth. So here you see the same exact thing. So here we can see the mouth. When we talk mouth, we'll go to the mouth and we'll go to the associated organs here as well. Now when we talk about the mouth, I want you to know that the mouth is a mucosa-lined cavity. It is a mucosa-lined cavity. We also refer to the mouth as the oral cavity. And the function now of the mouth is that it's going to start ingestion. So when we talk ingestion is going to happen here. Also, it begins the propulsive process of swallowing. So that's number 2. And number 3, it's going to help with the chemical digestion. It's involved with a little bit of chemical digestion. You have salivary amylase, which is going to help break down starchy foods, and you have lingual lipase, which will break down fatty foods. Lingual lipase. Lipase. Not chase. Lipase. A-S-E. So anyways, here let's move down. Let's talk boundaries then. When we talk boundaries of the oral cavity of the mouth, you can see here you've got the lips located anteriorly. You're going to have then the cheeks laterally. And then we'll have the palate superiorly. And then we've got the tongue down here inferiorly. So this is your oral cavity's boundaries. First, you've got the oral orifice, the opening into the oral cavity. That's the oral orifice. Then here we can appreciate the lips. Let's move over from that picture over to this picture here. Here we've got the lips then. When we talk about the lips are basically formed from the orbicularis, if you recall. And then you have a red margin on the lips as well. And that red margin is going to be the reddened area where a person applies lipstick or lands a kiss. Next then we have our cheeks. And we talk about the cheeks. Again, you should know the muscles that you have there as well. We've discussed those in the beginning. Your buccinators. Next in here you can appreciate the vestibule. Now we go through and we talk about the vestibule. Now we'll see the vestibule is going to be... Alright, so as we were mentioning here, we can appreciate the vestibule. So when we go through and we talk vestibule, the vestibule is going to be a space or a chamber you can think of. It's the chamber, the space that's bounded externally by the lips, as you can see right inside of here. And then the gums on the inside, the gingiva on the other side. So it's bounded externally by the lips, by the gingiva internally, and the cheeks. So you can think of lips and the cheeks here on the outside, and we've got the gingiva on the inside, and the space in between the two, right, is going to be the vestibule, or the chamber in between the two you can think of. Next then is the palate. Let's discuss this palate in greater detail. When we talk palate, we've talked and we've got 2 different parts. So recall hard and soft palate and go through those components as we have talked about before. The hard palate is underlain by the palatine bone and the palatine process of the maxilla bone as well. And it's going to help form this rigid surface onto which food is going to be forced during chewing. Next, then the soft palate, you can see at the dorsal aspect, and the soft palate is a mobile fold It's formed mostly of skeletal muscle, and it rises reflexively. It rises reflexively to close off the nasopharynx when we swallow, to help close off the nasopharynx when we swallow. You can also appreciate here then the uvula. Now the uvula is a pendulous structure. It's a pendulous structure, finger-like structure you can think of as well, and it projects downward. It projects downward from the free edge of the soft palate. That's the uvula. And the uvula along with the soft palate are going to help to block off the entrance into the nasopharynx. Next then we've got our palatoglossal arches. The palatoglossal arches are going to be appreciated here very nicely. Here we can appreciate the palatoglossal arches. Everything is in the name. And then here we can see palatopharyngeal arches. Dorsal to the palatoglossal arches. Next then we've got the tongue. So we talk tongue. Tongue is going to be found occupying the floor of the mouth. It occupies the floor of the mouth. Fills the oral cavity when the mouth is closed. It fills the oral cavity when the mouth is closed. And the function, when we talk functions, the function of the tongue is to grip and constantly reposition food. It's to grip and constantly reposition food between the teeth. Number 2, it mixes food with saliva. It mixes food with saliva. And number 3, it's involved with taste, right? We talked about that when we talked about the special senses. Now, when we go through and we talk muscles, muscles we have various types. We have first intrinsic muscles. Intrinsic muscles are going to be confined in the tongue. They are confined in the tongue, and they are not attached to bone. Intrinsic muscles. And then the extrinsic muscles, they're going to extend to the tongue. They will extend to the tongue, and they're going to extend to the tongue from their points of origin on bones of the skull or the soft palate. We have seen and we've talked about the papillae you have in relation to the tongue, and we've talked about fungiform foliate and circumvallate papillae. So let's talk then the filiform papillae. Now, when we talk filiform papillae, the filiform papillae are going to give the tongue's surface a roughness. They'll give the tongue's surface a roughness. And this roughness is going to aid, in licking semi-solid foods. It will aid in licking semi-solid foods. And these papillae are also going to provide friction. They also provide friction for manipulating food in our mouth. And these papillae are the smallest and the most numerous papillae that we'll have when we talk about papillae. So then salivary glands, let's move to. Now when we go through, we talk salivary glands. We've got a couple of really good images depicting to us both of those. Images depicting to us the glands. So when we go through, we talk about glands. Salivary glands is what we're talking about. Now the function of the glands is going to be to secrete saliva. So their job is to secrete saliva. Then what does saliva do for us? Now saliva is going to, number 1, clean the mouth. Number 2, it's going to dissolve food chemicals for taste. Remember we talked about that? The saliva is going to be required there. Number 3, it helps to moisten food, the saliva does. And then number 4, you can see food is going to contain enzymes. The saliva is going to contain enzymes that are going to break down foods. So saliva is going to contain enzymes that will break down foods. And I mentioned to you salivary amylase and lingual lipase. Lingual lipase. Lipase. I guess it picks up light pace. All right. So let's go through and let's talk then in your intrinsic salivary glands. When we talk about your intrinsic salivary glands, these are going to be also known as your buccal glands. Your buccal glands. Now when we go through and we talk intrinsic salivary glands, they're very small, and they're going to be scattered throughout the oral cavity's mucosa. They're small and they're scattered throughout the oral cavity mucosa. Then we have our extrinsic salivary glands. We can appreciate here very nicely. These extrinsic salivary glands are going to be responsible for producing most of the saliva. And these extrinsic salivary glands are going to be found lying outside of the oral cavity. They're found lying outside the oral cavity, and they empty their secretions into the oral cavity. So they're lying outside the oral cavity, emptying their secretions into it. First one, you can see the parotid gland, found as a pair. Okay, parotid gland, when we talk parotid gland is going to be large. It will be large, and it's going to contain, we'll see, so when we talk these extrinsic salivary glands are going to be found as pairs. So first pair here we'll talk about is going to be the parotid glands. The parotid glands you can see here very nicely. So here you can see one, and the other one is going to be found the exact same way on the other side. Excuse me, just anterior to the ear I'll describe to you guys here. So here when we go through and we talk then, when we go through and we see, first we've got the parotid gland. The parotid gland is going to be, as we can see here, a very large gland, and it's found lying anterior to the ear. Lying anterior to the ear. And we talk about the parotid gland, you'll see it's found, more specifically speaking, in between the masseter, in between that masseter muscle and the skin. So in between the masseter muscle and the skin. And you can usually feel that gland here. When you eat something sour sometimes, you'll see they get going and they start secreting secretions. And here you can see when they secrete their secretions. When they secrete their secretions, you can see here those secretions are going to be emptied right there, you can see, next to then the molars. So here we can see its duct. Here you've got, it's called Stenson's duct. Now you can see Stenson's duct basically making its way down, and it's emptying, we said, at the molars. More specifically speaking, it's going to be the second molar. It'll empty right at the second molar. Next then we're going to be able to appreciate the pair of submandibular glands. Now submandibular glands, the name is telling you a lot there. They're walnut-sized glands. They're going to be found lying along the medial aspect of the mandibular body. Lying along the medial aspect of the mandibular body. Next, sublingual glands. Also again found as a pair, small, lying anterior now to the submandibular glands. Lying anterior to the submandibular glands under the tongue. And these glands, now you can see they're all going to open. Both these glands are going to open via 10 to 12 ducts. See, all these ducts are going to come in, and these ducts, they're going to basically open from 10 to 12 ducts into the floor of the mouth. You may have heard of gleeking. It's absolutely disgusting. Basically, the person is spitting, out in a controlled fashion from underneath their tongue, and they're able to allow those secretions to make their way out. It's disgusting when people actually do that onto people. Like I said, that spitting is what that is. Next then is teeth. Teeth. Let's go through the teeth and let's talk about teeth. So here we've got teeth. First, a nice picture here depicting to us baby teeth. Along with baby teeth, well, that's the sad thing about it, is it's a kid's skull we're looking at here. So we've got baby teeth and right out here, and then here's the adult teeth. Basically somebody young of age. So here now when we go through and we talk basically teeth, their function is that they're involved in food processing. Teeth are going to be involved in food processing. What teeth do for us is they chew or they masticate food. They masticate or they chew our food by opening and closing our jaw. So here you can see your teeth as well. This is from a panoramic x-ray. Here, nice view depicting both baby teeth and the adult teeth there. You can see the deeper lying teeth, the adult teeth, the permanent teeth, and then the more superficial teeth are obviously the teeth you see in the front. So here we can say, I don't know, just going on a hunch, I don't see any baby teeth in the front. About 5-6 years of age they come out, so there's probably somebody a little bit older, where the rest of these teeth haven't been able to make their way through yet. So here when we go through, sad having to see something like that, but well, here this is just a panoramic view, but when you're actually seeing a skull, that tells you what was there and whatnot. It looks like a real skull here too. The spongy bone looks pretty good. Now here when we go through, we talk teeth. So we have permanent teeth. Our permanent teeth are our deeper lying teeth. We have a total of 32. 32 permanent teeth. 16 in the bottom row and 16 in the top row. 32 total permanent teeth. Sometimes the wisdom teeth may erupt, or sometimes they're completely absent. And when they do erupt, sometimes they cause pain, sometimes they don't. Now let's go through each of the teeth. First, let's check out the permanent teeth. Here we've got our incisors first. When we talk incisors, we have a total of 4 incisors. Okay, so when we talk incisors, what I'm going to do, I'm just going to go through the lower row of teeth. Okay, or whichever row you want to think of, and then you have the same thing on the top. So I'll go through the first 16 and use double that, and then you have 32. I did not say you double 32. You don't have 64 teeth in your mouth. Don't tell me I said that. 32 total. 16 on the bottom and 16 on the top. Okay, for a total of 32 teeth. So let's go through the first 16. And the reason why I say that is because somebody asked me, we have 32 teeth? No, we don't have 32 teeth. Total of 32 pairs of teeth is what they were asking. And I said, well, not 32 pairs of teeth, a total of 32 teeth. So not 32 pairs, 16 pairs, equaling to total of 32 teeth. So here we've got incisors, 4 incisors. They're chisel-shaped teeth, and they're adapted for cutting or nipping off pieces of food. Next are your canines. You have 2 canines. Your canines are conical or fang-like teeth. They're cone-shaped or fang-like teeth, and they tear and pierce food. They're responsible for tearing and piercing food. Next, then we get into the premolars. When we talk premolars, we have a total of 4. Premolars are bicuspid in shape. They're bicuspid in shape, and they're adapted for grinding or crushing. They're adapted for grinding or crushing. And here you can appreciate then the incisors we went through and we talked about. Okay, so we got all 4 incisors, then we had the canines, and now here we are at the premolars. So 4 premolars, they're bicuspid in shape, they're good for grinding or crushing food. And the last we have our molars. We have a total of 6 molars. 3 on one side and then 3 on the other. Obviously, I'm just talking lower row. And you have the same exact thing on the top. So when we talk molars, 6 molars you see here, they're the best grinders that we have. Now when the upper and the lower row, they lock together, they generate a tremendous crushing force. They generate a tremendous crushing force. Hyenas. I was watching last night on Discovery. Hyenas actually have a good amount of tremendous crushing force as well. They actually are, they have the strongest crushing force of animals on land. Because if we're talking water, it's different. Very good, right? Alligators, I believe, or crocs have that stronger, the tremendous generating or crushing force there. So those are your permanent teeth. So again, I went through 16. 16 in one row, and then you double that, and you'll have a total of 32 teeth. Next then are your deciduous teeth, your milk teeth, or your baby teeth. I'm trying to say baby and milk at the same time. Bilk teeth. Yeah, pick me up as built teeth. Again, milk. So milk teeth, baby teeth, they're the first teeth to appear. They appear around 6 months of age. And then eventually they're going to be replaced, and they'll be replaced by your permanent teeth or your adult teeth. Let's go through now. You can see those teeth here again as well. And let's go through then the actual structure of your tooth. So when we go through and we talk about the structure of your tooth, first thing I'd like you to know, the tooth gets divided up into, as we can see, a crown, a root, and between the two you have your neck. Right? A neck is a constricted region. So here when we go through, we talk first the crown. Let's talk about the crown. The crown, I want you to know, is the enamel covered part. It is the enamel covered part. It's the exposed part, you can say. It's the part above the gingiva. It's the part above the gum. The enamel surrounds the tooth, as you can see, it surrounds that tooth like a tight collar. It's going to surround that tooth like a tight collar. Next then we have the enamel. So when we talk enamel, enamel is going to be this brittle ceramic-like material. It's this brittle ceramic-like material. It's as thick as a dime, so it's very thin. It's as thick as a dime, and it directly bears the force of chewing. And it directly bears the force of chewing. Next then is the pulp cavity. Now when we talk pulp cavity, the pulp cavity is, number one, surrounded by dentin. And it's a cavity, so it's a potential space. And it's going to contain a number of soft tissue structures. It contains blood vessels. It contains, you can see, connective tissue. It's going to contain also nerve fibers in there as well. So all of those soft connective tissue basically structures, we refer to them as pulp. We'll collectively refer to them all as pulp. So you have that pulp cavity. Next then is the root. So here, down here, we've got the root now. When we talk about the root, it's the portion that's embedded, the portion of the tooth that is going to be embedded in the jawbone, portion that's embedded in the jawbone. Now here in relation to the tooth, we've got cementum. In relation to the root, we have cementum. When we talk cementum, cementum is going to be found, number one, on the outer surface of the root. You can see. So we talk about the root. It's forming basically that outer surface of the root of the tooth. And the cementum is calcified connective tissue. It is calcified connective tissue that attaches the tooth to the periodontal ligament. That will attach the tooth to the periodontal ligament. Now when we talk periodontal ligament, the periodontal ligament you can see here very nicely now. The periodontal ligament is very thin, and it's going to anchor the tooth in that bony alveolus. It anchors the tooth in the bony alveolus of the jaw, helping to form for us a fibrous joint, as we went through in the beginning of the semester. And we refer to this joint as a, very good, Gomphosis joint. Gomphosis joint. Next then we have the root canal. And when we talk about the root canal is basically this, again, canal-like structure. It's this structure that's going to basically allow these blood vessels, the soft connective tissue structures, to pass up into the tooth. So the root canal is where the pulp extends into the root. Moving down, we have the apical foramen. The apical foramen is going to be the tiny opening that allows these structures up into the canal and then eventually into that pulp cavity. So the apical foramen. Then the neck, we see here is a constricted region. Constricted tooth region where now the crown and the root are going to meet. Where the crown and the root meet. And last here we can appreciate dentin. Now when we talk about dentin, you'll see dentin is a protein-rich, bone-like material. It's a protein-rich, bone-like material, and it's going to be found underlying the enamel cap. It underlies the enamel cap, and as you can see, it forms the bulk or the majority of the tooth. It forms the majority or the bulk of the tooth. So very good depiction of the tooth. Same thing, exact same thing you're seeing here. So when you talk a root canal, right, we go to the dentist, have a root canal. Basically what they're doing is they're drilling right into the center, and they're going to basically take these structures out of there and block this whole pathway up. And they'll grind the tooth down and put a new tooth on top, and it's about $2,000 probably now. I don't know, it was like $1,000 10, 15 years ago, but with inflation, these types of things go up. $500 for a root canal, and I think it was $500 for the tooth. Probably maybe 700, 800 bucks each now, probably something like that. All right, that concludes then this chapter. Or no, I'm sorry, this concludes the first part of this chapter. We'll continue then with the next part.